Let's begin. Thank you very much for joining us in this session on thinking and planning for scaling the impact of research. Thank you, Simon, Kerry, and Hayley for joining us today. Good morning to you, Hayley. I know it's early in Ottawa, as well as for me. And good afternoon for you, Simon, in Italy and the UK. So quite a few locations for us from where to talk about this. My name is Enrique Mendizabal. I'm the director of Think Tanks, and I'm just going to moderate the session. And I will let Simon get us started with this discussion by sharing a reflection that we've been having about how to connect what up until now, I think, at least in my mind and probably in the mind of others, were two separate conversations about research uptake, the work that most think tanks are worried about, getting the research to be picked up and listened to and used by policymakers, at least in policy design, and this field of implementation or achieving impact of that, realizing impact of that research, which is something that has dodged many think tanks for quite some time. And hopefully in the conversation we'll have over the next hour, we'll come up with some interesting, useful implications for both policy research organizations and those that support them, whether they're funders or those in the rest of the policy research ecosystem. I will invite you, everybody, to offer your comments and ask questions in the chat. And if you want to join in with video and audio, just let us know, and you can just click on share video and audio, and I will let you in to share with us later. Okay, Simon, do you want to get us started? Oh, should we do a quick intro? Just names and who you work for and what you do very briefly, so everybody knows you.
Yep. Hi, I'm Simon Hearn. I'm an independent consultant based in the UK. I worked for quite a number of years, about 10 years, at the ODI in the research and policy and development team, where we looked a lot at the interface between research and policy. And more recently, I'm involved in an evaluation for IDRC, where we've been looking at IDRC's approach to scaling, which is where we've started asking a lot of questions about the interface between research uptake and scaling, as Kike mentioned a bit more in a moment.
Hayley, do you want to introduce yourself?
Sure. Hi, I'm Hayley Price-Kelly. I'm a evaluation program officer at International Development Research Center, and I've been working along with other members of our team for the past few years on our work on scaling science, and looking forward to sharing a bit more on that.
Thank you. Kerry?
Sure, thank you. Kerry Albright. I'm Chief of Research Facilitation and Knowledge Management at Unicef's Dedicated Office of Research in Chieti in Italy. I've been here for about six and a half years now. Before that, I was at DFID, where I headed up as one of other roles as well, a section called Evidence into Action, trying to make sure that evidence does get taken up and used. And before that, still, I worked for a program called Research into Use, which was trying to look at how to scale up agricultural successes. So I hope to bring together those various interests today.
Simon, do you want to get us started with this a brief intro about what are we trying to talk about today?
Yeah, and it's really a hypothesis at this point. Although I think when we hear from Hayley about the work that IDRC is doing, it becomes a bit more grounded. But the hypothesis is that we've been talking about research uptake for a long time, particularly in various circles, and there's been an evolution in ideas, and research uptake was where we were, probably from 10 years ago up to recently. And there's a new idea around scaling, which adds something new to this discussion and adds value and adds critical thinking. And this is what we want to explore. So I've just got a very brief one slide that might help So 4 domains of knowledge to action, I'm calling this. It's nothing grand. It's just a few ideas on a page. But you can see, it starts with knowledge generation, and some researchers, that's what matters to them. That's why they're there. That's what they're focused on. And for some, that's fine. The world needs knowledge to be generated. But at some point, people started asking, well, is it enough to just generate knowledge? That you want to position it and communicate it and make it accessible? So then there's this paradigm of communication, of dissemination, or producing policy briefs and turning your research into other products that others can use. And for some that's it. They do that that kind of initial knowledge translation, but they don't do anything more than that. And then people started asking, okay, well, isn't there a role to try and support use of research and do a bit more than just publish the policy briefs, but involve the policymakers in the research, ensure that the research is demand-led, and build capacity of decision makers to make use of those findings. So then you get this idea of research uptake, and that gets built in. So scaling takes us one step further and says, well, we actually need to be considering how those findings are used and how they actually benefit people at a larger scale or at a particular scale, which gets into implementation. How are those policies implemented that we're influencing? And you can think of the kind of results that we're looking for at each of these levels. New knowledge developed, accessible, use-focused evidence and insight is developed. Changes in policy and practice is what we're really looking for at uptake. But at scaling, we're looking for improved lives and livelihoods. And thinking about that as your endpoint could have an impact on how you design your whole program. That's the hypothesis here. So there's kind of design considerations. So if you're just considering knowledge generation, your main consideration is how to ensure research quality and relevance to research questions. If you're focusing on communication, you're going into relevance for particular decision makers and accessibility. In uptake, it's about supporting the use of evidence. And then at scaling, it's how to optimize the benefits and minimize the negative consequences for particular groups that you're concerned about. So that's sort of framing really the discussion on what scaling is and distinguishing it from sort of previous iterations. And really it's an open conversation. Does this add anything? Does this help us? Is this maybe what we're already doing? So I'll leave it there.
Thank you, Simon. And then I wanted Kerry to ask Kerry to come in and maybe give us a little bit more of an intro or set the scene about sort of the initial parts of that framework you talked about, especially the uptake bit.
So like Simon, I mean, when I was first asked to talk about this, I really hope this is a conversation, because I think it's quite, for me at least, quite early to bring these ideas together. But I think, so I have a few loose, unconnected thoughts perhaps that sprung to mind when I was thinking about this over the weekend. So, I mean, as Simon said, I think, obviously we've heard about this evolution from generation to communication to uptake in terms of research uptake, which incorporates, those supply and demand elements, including things like stakeholder engagement and local partners and capacity strengthening, which we know are essential to thinking about scaling up. But when we're asked to think about research uptake, there's still a tendency to think about promoting our own research, our single study. And there are very few incentives within the system to think about strengthening the system for scale as a whole and promoting work other than your own. So I think, evidence synthesis perhaps has moved beyond that to think about focusing on bodies of evidence, so not just your own research, and maybe gives a sort of entry point for having a little bit more confidence in terms of things that maybe there's potential to scale. But it focuses very much on what works, and we really need to be able to shift that dialogue to also think about to think more about incorporating contextual evidence, implementation factors, political economy, resources, etc., into those sorts of analyses as a matter of course. When we're thinking about research impact, we all know that we shouldn't just zoom straight to thinking about instrumental impact or policy impact, but there's a lot of incentives both amongst research grantees and amongst research funders who report up to ministers to focus on those policy changes. But perhaps what we're not so good at capturing as a whole is the other forms of impact about the process of conducting research. So if we're thinking about things like, how we systematically capture strengthening capacity or building confidence or strengthening networks or partnerships, as well as just the outputs, I think those will also, if we manage to shift the focus back there a bit, will also help us to build in some thinking about scaling up from the outset. Another issue, as we all know, we often get stuck at the policy formulation phase. And as Simon said in the beginning, we don't often track through to implementation. But that's also partly because, A, there are a few incentives to track beyond the end of a project once people move on from different projects and the research grant runs out. But also, I think there's a lot to be done in terms of development of methods to help us track those longer-term development outcomes, sort of 10 years hence after a research project has ended. And it's a lot easier for us, either research funders or researchers themselves, outcomes, or to stop at those to impact. There have been recent years, so certainly. I work at Unicef and Acenti, but elsewhere there's been a lot more thinking about implementation research. So embedding research within programming or policy cycles, thinking about adaptive learning and iteration. And arguably one could say that if you start with that, if you start with principles like local ownership, setting the research questions, iteration and learning as you go along, then perhaps maybe there's no need for a research uptake strategy because you've got ownership and engagement built in from the outset to help enhance sustainability. And I think also another thing that really struck me is that, when we're doing things like meta-analysis, we're often taught to ignore the outliers. But these are sometimes the most interesting in terms of scaling science. So here in Acenti, we have a program called Data Must Speak, which Hayley will well know, funded by the Hewlett Foundation, IDRC and others, which is really saying there's a huge amount to learn from those outliers in terms of scaling, where they're given the same resources, the same skills or capacities, but completely outperform their competitors. So I think that's worth thinking about as well. I have one more slide just to, a few things that are on my mind when I'm thinking about scaling science. So obviously, when you're thinking about solving complex or wicked problems, you have to think at scale and also think about system strengthening. But that's really difficult for people. There's both a sort of issue of turf, in terms of resources. Nutrition was a classic sector that fell between the gaps between health and agriculture. And a gain for another sector may be a detriment to your own. So that's quite hard. Similarly, thinking about trade-offs, if you're talking about, say, an educational intervention where your objective is to get more kids into school, that could be a success, but at the same time, violence or bullying against children could go up. So how you actually think about those trade-offs and think holistically, including how you sequence the interventions. Maybe there's something that we really don't understand about the order in which you intervene that enhances the chance of success or scale up. I mentioned again, I think we need to focus on strengthening the whole evidence ecosystem. But again, there's similar challenges. People talk a lot about systems thinking, system strengthening, but it's not easy to do. And there are very practical considerations as much, where your champions rotate or your staff leave a project, election cycles. We know all of this from the classic sort of research uptake language. Also things like, trying to get donors to coordinate is problematic. Short time frames, again, people tend to think in budget cycles of 4 or 5 years, where we know it's going to take 15, 20 years to see systemic change. And there's a lack of practical funding around these days to support those important brokers in the middle, the intermediaries or networks. We know that private sector are essential to scaling up. There's a lot that we can learn from the innovation systems literature and other, but that's for their insights are valuable for scaling a particular sort of product or innovation, I guess. And there's still a massive role for the public sector and others for thinking about those for whom there isn't a profit margin, for those that are left behind. So I think we need to think there. I mean, another tricky issue with the impact evaluations, even if you want to believe, and I know there are different views about value of impact evaluations, but taking as read that they're a good starting point for what works, there are still issues where they found, even when there have been positive effects, the scaling pathways, even if you take into account that you obviously need to consider sort of local context and skills and capacities. But even then, there are different potential scaling pathways for policies, products, and processes. So scaling up a widget, a vaccine, may be a lot easier than scaling up a policy or a way of thinking. I think there's a lot around behavioral sciences that we still haven't properly integrated. There's been an evolution to thinking about sort of merging natural and social sciences and the mutual value of them. But behavioral sciences, in a way, is still quite late to the game, but it's an obvious area that we ought to be working with more in terms of thinking about how you frame messages and nudging. And I said, including reverse nudging. So the classic nudging is getting governments to think about how to get their citizens to behave differently. But I think there's a lot more that we could do with nudging in terms of thinking about how to strengthen evidence-informed decision-making. Mm-hmm. And then I think, I'm not sure if this is the last one or the penultimate one. The evidence base is skewed. We all know this. There's very few incentives to actually document failures. Everybody talks about successes. So you have to really dig to find out what hasn't worked a lot of the time, because people don't want to talk about that as much as they do about what they do think has worked. And then this is the final one. I think the other really tricky issue for many of us is that expression, I think a lie gets halfway around the world quicker than the truth has had a chance to get its pants on, or something like that. The people that are effective champions for bad science in wrong places often very effective at scaling up. So the example I always give is thinking about the case of Matthias Rath in South Africa, thinking about arguing that basically vitamin pills would help to cure the HIV/AIDS pandemic, and there was no need for antiretroviral therapy. Highly, highly successful. So I'll stop there for a minute. I have a few more thoughts on what we could do differently, but I'll come back to those later.
And so we've been talking about scaling quite a bit. Let me go back to Hayley. Let me go to Hayley if she can tell us a little bit more about how IDRC has been thinking about this concept of scaling impact.
Yeah, great. Thank you. I'm just going to share my screen. All right, so this issue of moving our focus beyond uptake and towards impact has been the focus of IDRC's work on scaling over the past few years, precipitated by the inclusion of a strategic objective on scaling in our previous strategy. And so this work in scaling science, as we've called it, is a bit of a double entendre for us. So we're aiming to contribute to an understanding of what scaling looks like and how it can contribute to impact. And also based on this, to kind of promote a principles-based approach to scaling scientific research results. So bringing these together, I'm just going to, as a starting point, go through what we've learned through this study. And I think some of this will resonate with some of what Kerry said and maybe what Simon said earlier as well. So based on an in-depth study of what scaling looks like in research for development across the disciplines and regions where IDRC provides support, we put forward an evidence-based, principles-based approach to scaling impact of research for the public good. So looking across more than 200 research for development projects, it was clear that there's no one-size-fits-all approach for scaling, but what did emerge were 4 guiding principles that were commonly used to kind of guide scaling efforts. And together, these form our definition of scaling as a coordinated effort to achieve a collection of impacts at optimal scale that's only undertaken if it's both morally justified and warranted by the dynamic evaluation of evidence. So just to break this down a little bit more and briefly into the 4 principles that kind of constitute this definition. First, this principle of justification just says that we shouldn't only be asking whether we can scale, but whether we should scale. And that needs to be based on evidence alongside values. Second, we would say that bigger isn't always better, and scaling processes create a range of impacts. So we need to understand and navigate trade-offs between them and between the variety, the magnitude, the equity, and the sustainability of these impacts. So we're not talking about just scaling an intervention, but reaching the optimal scale of impact. Third, just recognizing that scaling is complex. It's going to require coordination and engagement with a broad range of actors, and really going beyond just immediately targeted knowledge users to consider others within the scaling system. So for example, beneficiaries, others who may be able to kind of enable the scaling process, as well as potential competitors that may be present as well. And finally, the 4th principle is really kind of key to upholding all these others, is that we just can't evaluate the impact of an intervention at a particular time and place. And we need to be thinking about the scaling process itself and evaluating that in order to understand the dynamic process of change, as well as how, why, and under what conditions we're achieving impact. So I think this goes back to what Simon was kind of sharing at the beginning, or aligns with it at least. And just to say that this approach and its focus on optimal impact really provides an opportunity or a call to look beyond these typical research outcomes that we've talked about, and that we tend to kind of focus on achieving and measuring. So this is a bit of a simplification. We realize there aren't going to be these clear lines between discovery, applied, or scaling science. But it's just aiming to show that scaling science is really pushing us beyond thinking about outputs or even these outcomes of things like policy change and behavior change, to really better understand this interface between outcomes and impacts and what's happening there that can help us to kind of get to this idea of optimal impact and understand some of these trade-offs that we may need to consider, and possibly adjust our approaches in response to that. So I think I'll leave it there for now. I think there will be time to get into more during the discussion. If for anyone who's newer to this, I know I've gone through this quite quickly, but there are these resources on our website, idrc.ca/scaling science, where you can learn more about the study, the principles, and kind of practical guidance for using those.
Thank you, Hayley. So let me pose a couple of challenges. So we heard yesterday from Anne-Marie Slaughter about the idea of a new think tank that is about change. It's Change Hub, right? That is thinking not just about research. That's the main thing, the creation of ideas, but these ideas have to be married to action, some sort of delivery of these. Something that is always in the back of my mind is that, of course, to connect to things that Hayley and Kerry said, good science can also lead to bad policy or bad recommendations or bad interventions, because we do not have all the evidence, all the information at hand. People do not respond in the way that you might expect them to. So I think every think tank out there will probably have good examples of their own research, done with the best of intentions and following all the research rules, but led to not the best ideas. Those are not the ones they would probably put in a story of change case study or in their annual report, but these exist. And that's what something Hayley, you said. There's the idea of dynamic evaluation of evidence. So even if you have, you've generated evidence and that evidence leads to some recommendations, you need to be constantly evaluating whether that still holds to be true. When you put it out there and you start testing your recommendation. So I always had a fear that when think tanks get involved in implementation of policy, even if it's a policy that they recommended, that they might become too entangled or too, they have vested interest in that implementation working. And they might not have that perspective or that distance that they often have with other policies, so that they can play that role of constantly evaluating the quality of that evidence or checking whether the implementation is being done in the right way. So here's a challenge that I kind of think about, in thinking about scaling impact. What role should think tanks play? Should they try to kind of drive the process? Should they play a much more distant role? Should they simply lay out the plans for how scaling should be done? Those will probably change, but what do you think? What could be the most appropriate role for a policy research institution in trying to promote the scaling of impact?
A couple of ideas, I guess. So policy research institutes or think tanks have a role per se in understanding whether government policy is working as it should be, right? So they in whatever field they're working in, they have an interest to know whether a government policy is delivering what it should be delivering, whether or not it was their research that led to that policy. So there's interest in that. There's a kind of a role to play generally, but I think if any researcher's work is being used in policy, they will have an interest in knowing whether that's having a positive effect. The problem is that they don't often have an opportunity to invest time in understanding that, because they can't play the long game. They have to move on to the next thing. So that, I think there's an ideal role. Yes, they should have a role in understanding the impact of the work that they're influencing. But I think there are too many challenges in following that up. There are probably a few examples of where that has happened, and I think if you know of anyone in the audience, then share them in the chat.
So, I mean, just to add to that, I mean, I agree, Simon. I think there's a role that goes beyond. That's what I was saying earlier about the potential of evidence synthesis. There's definitely a role for think tanks which goes beyond looking at the pathway between their own research, which is more about sort of bringing together and summarizing bodies of knowledge and acting as that broker and interface, so that you're looking at basing policy on a range of evidence rather than just a single study, which I think maybe partially counters the good evidence, bad policy situation that you were talking about, Kike. But I do think also, I mean, at the moment, I think that is a big vacuum generally. I mean, there's a lot of global dialogue around decolonizing development. We know that if we want to kind of think about scaling up, as I mentioned earlier, that we need to start thinking about embedding the research that we're doing into a sort of implementation research initiative, and trying to find ways to sort of learn from the process as we go along through adaptation. I take Simon's point about the fact that that's often hard to fund, or it's some poor research communication manager who it's 10% of their time and they're told to do that as well. But I think that, that the process is as important as the output. So we ought to definitely be looking to learn more about that and the brokering process, and think tanks are ideally placed to do that, because they're in country and help to contribute to the sustainable legacy when the international researchers are long gone.
Yeah, agree with a lot of what's been said already. And I think one of the things that we've been hearing or thinking about more with scaling is really thinking about scaling as a researchable topic in itself. And that means really having the opportunity to look and really investigate what's happening in a bit more depth, and going beyond just being able to say, well, we advise that they do this in policy and that policy affected X people, for example. Really trying to understand, once that's been put into practice, what can we learn about some of the trade-off that might have happened. So again, it's not just about magnitude or how many people were affected, but what can we learn about the equity of those impacts? Were they sustainable, et cetera? So I think it's an interesting question about whether the researchers who advised on that policy are neutral enough. But regardless, I think there is an opportunity to kind of engage more in understanding at that level in a bit more of a complex and hopefully informative way.
So to go back to the idea of I'll just put this in the notes, to go back to the idea of the hub that Anne-Marie mentioned yesterday. Some of the members might be those that would be charged with implementing or championing an intervention. They will be the ones probably pushing through, as Simon says, and playing the long game. That might be government, it might be the private sector, it might be NGOs, it might be a research department from a university with long-term funding. It might be a partnership between private sector and academia. Think tanks might play a different role. They might play kind of a dynamic evaluation of the evidence role. They might play the role of studying, as you say, Hayley, studying how scaling is happening, how it's going, how it's working, how it should work, bringing in lessons from how interventions in other contexts, in other sectors have attempted to achieve this impact at scale. It could be the convener as well of these different actors. So it could contribute in an indirect way, but not less important way, to seeing the impact of research being sort of achieved at a larger scale or the appropriate scale. We're not suggesting that they are the ones that have to also go out and implement their experiment or their initial finding. Right? Would that be a consensus among us that that's not something we are necessarily encouraging?
I think the concept of scaling forces you to take a systemic perspective.
Yeah.
To say, if you want to scale the impact on certain groups and optimize the impact on certain groups in terms of their quality of life or the environment, then a single program is not going to achieve that. It's about looking at that in the context of what else is going on. So the idea that a program can achieve an impact is not the way to scaling. So this idea of a hub is interesting because it's recognizing that there's like an ecosystem. There's a system of actors, some of which are working towards that impact, and some of them have kind of a different incentive, but nonetheless are involved in or can be influential in that journey. But so yeah, I think the idea of a hub is interesting, but it's like it doesn't marry with our idea of research programs and the way that funding supports research, because it's like one step removed, and no one's in control of that network, right? It's a kind of it's a free mechanism that's kind of lots of different actors working in different ways. Well, yeah, I can see how it's useful, but it requires us to think in different ways.
Yeah, and I would agree. Kind of thinking back to what I was saying earlier about the sort of the evidence ecosystem, I guess. A lot of think tanks still get discrete funding for particular outputs or etc. But there's not many funders, some notable exceptions, that do fund those networks, that interaction, that learning. It's kind of tied to a research project, and when the project ends, the network funding ends. So I mean, when I'm thinking about the sort of the work that I'm trying to do at Unicef around building this an evidence culture and evidence ecosystem for children, there are lots of different modalities that we're kind of looking at. And, the power of networks, places where more systematically ideas can be brokered, where intermediaries, whether it be media, policymakers, researchers, can come together and on an ongoing basis can debate and discuss issues beyond individual projects and looking at scale is really important. But there's not a lot of funding for that sort of thing. So I like the idea of a hub. I just think you have to make sure that it's it's sustainable, it's not tied. There's some sort of core funding element, I think, that allows free space, free thinking, etc., rather than tied to discrete outputs. So that requires a bit of a change of thinking from a funder perspective as well.
And maybe just to add as well, I think that's one of the things that we've heard kind of loud and clear in talking about this scaling work with our grantees and others is kind of key to this, whether there is this hub or however we're pursuing it, just recognizing that this network that we need to engage with for successful scaling is going to continue to change as we learn more and as the process progresses. So really just kind of a call for flexibility for ongoing engagement and consultation with this kind of shifting network of actors that need to be engaged, that we can't necessarily predict at the point of having a proposal or designing a project.
Let me go back to something Kerry said. Does it mean then that think tanks themselves have to think, think tanks and funders might need to think beyond the project, but also beyond their project? And if you work in a certain field, as agriculture, and then part of the role of think tank is not just to think, okay, what new idea can I come up with, but also think of what idea out there has the potential for scale, and can I do the research to help map out those potential pathways to scale, and then can I do the research to help identify roadblocks to that happening, and maybe can I actors in that sector so that each one of them will see together they'll assign roles, whether they'll emerge or they'll be designed. But so as Kerry says, not tied to my project, not tied to a project, but looking at a more sectorial view, or maybe multi-sectorial view, and that would shift a lot. Require a big shift in the way think tanks think about, I am making recommendations based on my research rather than acting this policy entrepreneur or scaling entrepreneur role by connecting others and helping others achieve results.
Yeah, and that's hard. Yeah, it's not even a project. It's beyond thinking about your own institution. It's about thinking, what in my particular country or context, if I imagined a world differently, what do we actually want to see change? And then working backwards, what can be my contribution, and where do I need to bring in other partners and players, which is completely different from traditional grants, where it's for a particular project, and your success or failure is how well you've got your research taken up into policy or practice. So you start at the completely opposite end of the spectrum. So yes, think tanks, I think, can play this important role and have a responsibility to be that broker. But as funders, we probably also have an important role to look at incentives, or carrots or sticks, actually, to actually make sure that collaboration and that sustainability is built into grants that are funded.
And with that, can we ask ourselves questions about, so how should funders think about this as well, and what can research funders do? Like, for as you say, Kerry, it's not just about funding a research project or research program. It might be giving money to scale what's already out there, or to support these connections, or encourage these interactions between actors. It might, just thinking, it might be that some traditional research funders might end up funding non-research organizations, because that is where you're going to get that scaling or that impact from the research that already is out there. Maybe in partnership building as well. Typically, research funders support partnerships between research organizations, but maybe those are the least relevant for achieving scale, and the partnerships they need to support are between research organizations and the private sector and government and social movements and NGOs and grassroots, non-research actors, those. And then I'll let you guys address the issue of long-term funding and flexible funding, because you can't tell what's going to happen with these projects, even less so than you can tell what might happen with uptake. I don't know what reflections you have on the role of research funders in trying to promote this.
And this is something we've been thinking about, as I mentioned, through engagement with our grantees as well, in terms of what we can do to better support this. And I mentioned one already, just kind of this, I think the critical highlight is just flexibility and acknowledging that some of this is going to change over the life of a project. And I think as well, we're very conscious that there needs to be kind of support for kind of coordination with the project amongst these different actors. I think we've also heard that IDRC being a research funder, we're not necessarily going to fund implementation, for example, but we can help perhaps to put in place the kinds of connections that might be needed to take that forward, whether that's with the private sector, whether it's with governments, whether it's with other funders. And I think just kind of brokering some of those relationships as best we can in our support. And I think as well, one of the things that we've heard, and I'll maybe just leave it at that for now, is just on kind of this idea of trade-offs between magnitude, equity, sustainability of impact. There's still this kind of disproportionate emphasis on the magnitude of impacts, and just trying to kind of advocate for more of a focus on these other aspects as well, whether that's through different approaches to evaluation, et cetera. But that's one of the things that we've heard could also be a role for funders who do kind of have this in mind.
Kerry, thank you.
Yeah, I mean, there's two or three things that spring to mind. So I think, as funders, there's a responsibility that we maybe have to think about some mechanisms that help enable tracking of ongoing impacts or development outcomes after programs have ended, including mandating a role for sort of local scaling partners or governments from the outset. So even though, I mean, obviously a program ends, but, are there sort of add-on grants or some more innovative way of actually making sure that the ongoing tracking of impact and feeding into scaling is assessed? Because at the moment that falls between cracks when people leave jobs, either as funders or as researchers. I mentioned already, I think, the need for thinking about incentives to get researchers to, quote, promote the work of rivals. So you think about the system or the evidence culture as a whole, rather than your particular piece of research uptake, and incentivizing collaboration there. There's definitely more that could be done around looking at more innovative methods and tools around facilitating adaptive learning. I think we're still, things are emerging, outcome mapping, Roma, obviously, but there are some others. I think the field is ripe for innovation beyond sort of intermediate impacts, thinking how we could come up with new methods. And then finally, I mean, this issue of timing or phasing. It's incredibly difficult for many funders to consider pooled funds because we all have to report on our own outcomes up the chain, as I said, but maybe pooled phases or something like that, so you can kind of coordinate and stagger your projects and inputs over time, recognizing that even if you can't commit to a 15-year funding cycle, that maybe you could share that with other partners. And I think that's really important if you're talking about tackling those really complex systemic challenges, including implementation science or implementation and scaling up. It's impossible for one donor to do it alone, and I'm sure there's a lot of wastage and duplication.
Just two things to add. One is the idea of a portfolio. So going along with this idea of a change hub, and I'm not sure, I have to admit I didn't listen to the keynote from yesterday. I know, but I'm imagining less of a defined set of actors, but more of an amorphous network of actors working in some general alignment, but maybe different directions or different incentives. So a funder could have a portfolio that looks across that. If they have a kind of mapping of that network, they could strategically fund initiatives in different areas of that change hub, which can involve different levels of risk. Some of it's core stuff that they're used to funding, and some of it could be sort of going outside of what they're used to. But having a portfolio they can balance those investments. And the other idea is that there's a sort of halfway between just funding research and funding a whole bunch of actors across this change hub, and that is that the research they do fund could be positioned with the scaling lens, and therefore can start to involve other actors, and the funders can have a role in supporting their grantees to bring in, as Kerry was saying, the scaling partners from the beginning, with that view. Okay, so they may not be able to track their impact. You may not know what the impact is going to be in the lifetime of the project, but if you have that lens of that's where we want to get to, then it changes the questions you're asking right at the beginning. It changes how you're designing your program.
Yeah, I think that takes us back to when Simon and I were at ODI, and we talked about research uptake. One of the first things we said is that to make sure to maximize the chances of uptake, you really want to do it. You need to think about it from the beginning of your research project. And I guess the same thing needs to apply for scaling the impact of your research. But here's a couple of questions that come to mind, and it's about the scope. Like where do we try to achieve impact at scale? At the national level, at the global level, at the thematic level? I mean, I guess depending on the issue, it'll be much more appropriate to work locally, or it'll be possible to work globally or regionally. But issues about justification, the moral justification of scale that Hayley brought up, or the appropriate scale at which we're talking about. I mean, those things have to be addressed, I think at a more local level, right? Closer to those that are going to be either beneficiaries or are going to be affected by that effort. It might require other kinds of evidence that science doesn't necessarily give you, or perspectives. So that's the first thing. It's about the scope, or the space in which we are talking about scale that I would worry about. And the other one is about definition. If you want to bring different funders together, does everybody agree on that balance between the sort of magnitude of the scale and so what was the other quality, or you mentioned, Hayley?
Magnitude, diversity, equity, sustainability of the impacts.
Exactly.
Yeah.
So it might be that people are worried about the magnitude, whereas others are worried about the sustainability, the equity of that intervention. So again, I think there's a space for funders to have to agree about what they want, and also there's a space for think tanks and others to agree. What is that level of scale we want, and what is the impact that we want to achieve. And I don't know if those will be the same, right? It would be the country level, the regional level, the global level.
Maybe just to jump in kind of from your first point there, I think it's kind of like this blur between what I showed earlier, this applied science and scaling science. I think typically we go in a more kind of applied science approach with a particular level in mind, that we're kind of prepared to target a particular knowledge user and kind of go from there through uptake. And I think it's not necessarily a question of whether we should be working at national or local, but as we kind of learn more at that level, thinking about the kind of scaling effects and how those trade-offs occur as we might move to more local or national, regional, global levels. And I think that's kind of where the scaling piece comes in, is just thinking about what else we could be doing at different levels to get to that, again, the optimal impact, where we're not just thinking about how broad coverage we can have or this kind of thing, but we're really trying to affect the right people, processes.
Thank you. There's a comment from Petronella. I don't know if Kerry, you want to follow up from what Hayley said? Otherwise,
No, I'm happy to. I will, but I'm happy to come back in if we've got the comment. I haven't seen that.
No, go ahead, and then I'll bring up Petronella's comment.
Okay. No, I mean, I was just thinking out loud with this one, because I think that's quite tricky, because there are some issues that more or less from a normative stance, we would want to see it scale. So if there was something, something like ending child marriage or preventing violence against women, or even things like, climate change, where you have to consider it, because even if you're successful in one country, there'll be transboundary effects. So some issues have to be looked at scale. But then there are also, the issue of cultural adaptability, and some things that have worked extremely well in one country may not in another, or may not be wanted in another. And again, I think this is a role for think tanks to kind of bring in that sort of that local context, that desirability, that that understanding of whether or not it's needed here, rather than sort of going by default to a sort of systematic rollout. So that's my immediate thought.
That's very interesting. And also that defines the kind of think tank that might participate in different debates and in different moments. Petronella asks what I think is a very practical question, but very interesting, is that often what happens is that there is not enough information about what's trying to be scaled. And so initiatives tend to build up from the researchers' work, and then partnerships, and then all of a sudden we find out that there's this policy and there's this private sector initiative, this funder initiative with a little money, and they're pushing for that. So one, that prevents researchers maybe promoting the work of rivals, but it might also prevent researchers auditing the work of rivals or partners or comparators, and providing that other evidence or that multiple sources of evidence that you were referring to, Kerry. So that's access to information might actually hindrance effective scaling of good science, because often we don't have it.
Completely agree. And now we're on to a completely different conversation about the importance of open access and transparency and documenting methodology, etc., and putting things out in the open domain, rather than locking away that knowledge in individuals' heads. But it's a very good point.
So I'm mindful of an hour, and it feels short, but these online events, maybe it's best to leave on a high, rather than people looking at their watches and see. So we can continue the conversation if we are interested. Louise Balls has shared a Twitter account, Scaling Science, that where we can probably continue the conversation. But I don't know if I'll give you each a moment to reflect on anything that has come up from our discussion that we could probably take forward into that space, online, or hopefully one day face to face. Simon, do you wanna?
Yeah, I guess one idea, which is about whose responsibility is this, and I think when we're venturing into the realm of impact and trying to see change in people's lives or change in the environment, we're coming to a place where you can't assign responsibility to any single program or any actor, and there's a collective responsibility, and that has implications for how you design these programs and how you hold them accountable for what they are aiming to achieve, what level of results you set for them. I tend to work a lot with monitoring and evaluation and results frameworks for programs like this, and it's always tricky. To what extent can you hold a program accountable for achieving certain results? You don't want to limit them to just achieving policy influence, because it has to be policy influence that's significant and is actually going to lead towards the impact, even though you don't know if that's going to happen. So that's always the quandary, and yeah, it's this balance between accountability and learning in a results framework.
Yeah, maybe I'll just jump in because it kind of relates to what you're just saying, Simon. But I think there's this accountability piece and what we can be held accountable for. But I think another thing that we've heard kind of loud and clear is just pushing for more of a focus on kind of a learning framing at this level, and certainly having kind of the methods that we need to kind of understand that level of change. But it might not be an accountability lens that's the most useful when we get to this level. And I'll leave it there since my child is brushing his teeth on camera.
Could be worse, Hayley. And for me, I think, I think this is such an exciting conversation. I think what I would really like to see is, and IDRC have been fantastic in leading this space, but I would like to see us as a global community moving beyond the buzzwords, genuinely unpacking, rather than talking about what is system strengthening, what needs to change, what is adaptive management, how do we actually apply, and what are the barriers. And so this conversation that we've started here to really carry through, because I think this is an area that is ripe for innovation. We've moved a lot in this space, but I do see, the intersection of research uptake, of scaling science, of implementation research, of behavioral sciences coming together. And I think it's a really interesting time. And I think, I hope we do carry this conversation onwards. And it's a great role for think tanks to play to get us to think more about this.
Great, thank you very much. So at the very least, the role think tanks can play is to treat this issue of scaling the impact of research as a researchable subject, which I'm sure will open up lots of interesting avenues of research and analysis, and that will probably lead to excellent recommendations for various actors. And hopefully we can continue this conversation. We'll be inviting people to join in, maybe a follow-up meeting. Thank you very much, Kerry, Hayley, and Simon, and everybody else who joined us.